Parkinson's disease is a progressive movement disorder affecting millions of people around the world. Kinesia HomeView is an FDA-cleared-to-market system designed to help medical professionals and biotech drug development companies optimize therapies for Parkinson's disease patients. The motor symptoms associated with Parkinson's, such as tremor, slowed movements, and stiff joints, can have a significant impact on patient quality of life and their ability to perform activities of daily living.
I won't eat soup in public. I'm very cautious about drinking soft drinks and coffee in public. I've learned to compensate by using both hands. I don't even go near a paintbrush, which is not a bad thing.
With writing, signing checks, usually make checks out ahead of time except for the amount if I'm going to write a check, someplace.
Very hard to write. I have a little trouble buttoning like the top button on my shirt sometimes, or buttoning the sleeves.
At the time I was diagnosed, I was still pretty active, and I used to be able to play basketball, shoot baskets, things like that. That deteriorated over about 3 years. It's about the last time I was able to do it. And so that changed my life a lot, being able to work out and play basket.
Clinicians must assess how well therapies are working to control Parkinson's disease symptoms. The current standard for evaluating symptoms in the clinic is called the Unified Parkinson's Disease Rating Scale, or UPDRS.
Our assessment tools consist basically of a routine neurologic examination and a Unified Parkinson's Disease Rating Scale. The UPDRS is the gold standard for evaluating patients with Parkinson's disease, and we routinely use the motor examination part in assessing patients on their return visits to our clinic.
While in-clinic assessments and subjective rating scales can be useful, these ratings may vary from one clinician to another, and the scales have limitations in assessing the complete picture of patient quality of life at home.
One of the limitations of the scale is that it is not very functionally based. It does look at patients' ability to get out of a chair and walk, but it doesn't assess their ability to complete routine activities.
Parkinson's disease patients often feel the symptom they experience in the in-clinic assessment do not actually reflect how their symptoms change over the course of a day at home and how the activities most important to them are affected.
He's still independent, dresses himself. If we're in a hurry, I have to help him, or else we won't be there on time. He can fix himself a simple meal, but when he was on full medication, he would be dizzy and unsteady on his feet because he had to turn around so much to get this out of the refrigerator, put that in the microwave. So it's easier if I fix his meals for him, but he can do it. I could leave him alone, he'll do it himself.
The assessment in the clinic is really just a snapshot. If you look at this video, for example, and you took a single frame from it, you'd have an idea of what we get in the clinic as compared to how much that means to the person's daily life. We don't have a whole lot of information based on the short visit that they make to our clinic. So we depend a lot on the historical information that they get.
Many times I have to do things like learn to eat with my left hand as opposed to my right hand, slow down with some activities, make sure that it's the right time of day or the right day of the week.
A medical device manufacturer located in Cleveland, Ohio, has developed Kinesia HomeView to help track how patients' symptoms can change throughout the day. This technology has been validated in several clinical studies as well as with patient focus groups. Kinesia HomeView is a compact kit taken home by patients and used over a few days to quantify and track Parkinson's symptoms through automated motor assessments and a simple touchscreen diary. There are 3 easy steps to using Kinesia HomeView. First, a clinician logs into the secure CleveMed HomeView website and sets up a patient study. The clinician defines the dates and times for the automated motor assessments as well as diary and medical information. Next, the patient takes home the compact kit and follows the prescribed instructions, which are indicated by touchscreen prompts and videos. This includes using the diary during the day to enter how they are feeling at various times and when medication was taken. Additionally, at times prescribed by the clinician, the system will alarm to let the patient know it's time for an automated motor assessment. The patient then puts a small sensor on their finger that contains miniature motion sensors and follows on-screen instructions to complete tasks similar to those included in the UPDRS motor assessment. Once the assessment is complete and data is uploaded to the server, a clinician can log back into the HomeView website to view the patient report. The report includes an intuitive color-coded chart that details symptom severity changes over the course of a day. Severity scores are calculated by automated algorithms using the quantitative motion data. These algorithms have been clinically validated and correlated to the UPDRS. Clinicians can also click on individual scores to view videos of the patient at home performing the tasks.
The ability to capture information at home allows for multiple daily, even hourly, if necessary, evaluations, something we simply can't do on a practical basis in a doctor's office.
The Kinesia HomeView technology has several important applications that can be used to optimize medication time or dosage, minimize symptom fluctuations, assist with programming deep brain stimulation across multiple motor symptoms, provide quantitative measurements with increased sensitivity for new drug development and clinical trials.
Well, I see two main applications for the HomeView system. One is of a diagnostic nature and the other is of a therapeutic nature. On the diagnostic side, we would be able to readily distinguish between tremor and dyskinesias, which patients are not often easily able to do. We're able to assess other aspects of their performance to tell whether their medication is working or not working. In other words, whether they're on or off. And be able to have a visual portrait of a patient's performance throughout the course of the day that I think would be more accurate than depending on people's recollection of how they're performing.
But he hasn't seen me off my meds, and I sometimes wonder if it would be beneficial for him.
Getting this type of feedback, I think, would be very beneficial for somebody that is trying to diagnose and treat.